Okay, so now we are going to get into the internal organization of the brainstem. And this to me is the most exciting part of neuro. It's really challenging to learn the internal organization of the brainstem until you understand the cranial nerves, but the cranial nerves are challenging to learn until you understand the brainstem. So try to understand this first and then go and learn the cranial nerves and then come back and study this again, and that's when it'll make the most sense. Okay, so if you look at the organization of the brainstem, it's actually organized sort of conveniently. So many of you have probably realized by now that while you are traveling up and down the brainstem, the fibers that are going to be located medially are going to be motor nuclei, whereas the fibers that are located more laterally are going to be sensory nuclei. And we can divide these areas even further by recognizing that what is going to be most medial are going to be somatomotor fibers, whereas, or somatomotor nuclei, whereas what is just lateral to the somatomotor nuclei would be the visceromotor nuclei. So it would make sense that the hypoglossal nucleus, which is the motor nucleus to the tongue, would be located in this general region, whereas the vagal motor nuclei is just lateral to it, and the vagal nuclei gives rise to visceromotor fibers to control your heart and your gut. So then, moving more lateral, just lateral to the GBE would be GBA fibers, because now you're in the sensory region. And then most lateral would be GSA fibers out here. So then located in about this general region are branchiomotor nuclei. And branchiomotor nuclei just means that it will innervate a striated skeletal muscle that is an origin of a pharyngeal arch. If you can remember this general orientation as you move up and down the brainstem, it will make memorizing the specific modalities of each nuclei and cranial nerve so much easier. Okay, so remember this general orientation as we're talking about most of the cranial nerves, because that can help you determine where it is based on its modality and its function, which we are going to add into this chart as we go throughout. But just remember that there are two cranial nerves that are not associated with the brainstem, and we're not really going to talk about them too much, but those are the olfactory and the optic nerve, which come off of the telencephalon and diencephalon. Then moving down from the midbrain to the medulla, we have cranial nerves 3 and 4, cranial nerve 3 coming off the anterior, 4 coming off the posterior midbrain, which is the only one to exit from the posterior portion of the brainstem. Then we have 5, 6, 7, and 8 all coming off the pons, and then 8 from 12 coming out of the medulla. So remember that part of 8 is associated with the pons and part of 8 is associated with the medulla. So we're going to fill out this chart throughout the video. Several of these cranial nerves are going to have both motor and sensory components, which means they're going to have multiple nuclei in the brainstem. Okay, so starting out with the medulla, we are just going to map out the important things that you should be able to see in the closed and open medulla. So for one, we know on the anterior portion of the closed medulla, we should start to have that pyramidal decussation that you can see in the closed medulla, which is just fibers from the cortex coming down and crossing into the contralateral side of the spinal cord. So those should be the lateral corticospinal fibers. Additionally, we know that we're going to have the nucleus gracilis and the nucleus cuneatus that are located on the posterior portion of the closed medulla, and they're going to be surrounded by their corresponding fasciculi. Located about here are the cranial nerve nuclei for the spinal accessory nerve. And this nucleus is going to be branchiomotor, so it's SVE. This nucleus is known as the nucleus ambiguous that gives rise to the branchiomotor fibers for cranial nerve 11. So we can go ahead and add in to our chart here that the accessory cranial nerve has SVE fibers that come from the nucleus ambiguous. And the accessory nerve is going to innervate the sternocleidomastoid and the trapezius. Okay, next let's talk about the spinotrigeminal nucleus, which is a sensory nucleus located just lateral to the nucleus cuneatus. So the trigeminal nerve is cranial nerve 5, which is actually, it exits the pons. However, its nuclei extend down into the closed medulla. So I want to point out that the orientation of the different modalities at this level in the brainstem is the same way that the spinal cord is oriented. So this is not the way that I described in the previous image in the video. That sort of orientation doesn't happen until you move up to the level of the open medulla, where the posterior portion of the brainstem opens up to form the fourth ventricle. So from this point on, that's where from this point up, that's when you can start to see the motor fibers that are in the midline, or the motor nuclei in the midline, and then the sensory nuclei more laterally. So in the closed medulla, we have this central canal, and this region is known, this gray matter around it is known as the periaqueductal gray, out around here, whereas up here we have the fourth ventricle, so the gray matter around here is the periventricular gray. So before this plate has opened up, you'll be able to see the motor fibers located midline around this portion, and then the sensory fibers a little bit more in this region. So when it opens up, you end up with the motor fibers here and the sensory fibers located out here. So at this level in the closed medulla, you'll start to see the first GSE nuclei that are located in the midline of the brainstem. The first as in moving from the bottom up. So that nuclei located right here is known as the hypoglossal nuclei. And the hypoglossal nuclei will give rise to a somatomotor nerve called the hypoglossal nerve that gives motor innervation to the tongue. So we can go ahead and add that into our chart as well. Also moving up, I forgot to add in that the trigeminal sensory nucleus in the medulla. Okay, moving back to the closed medulla, just lateral to the GSE fibers, we're going to have the DMX, or the dorsal motor nucleus, which is still going to be located in the midline. So they will be motor fibers, but they are going to be visceromotor fibers for the vagus nerve. And it makes sense that they're visceromotor because we know that the vagus nerve is what's involved in controlling many involuntary functions like heart rate. Okay, so we can go ahead and add that to our chart. All right, moving back to the closed medulla, we are going to add in a sensory neuron, or sensory cell body. And that's going to be the solitary nucleus located just next to the GBE fibers. However, these are going to be GBA fibers. The solitary nucleus is going to contains second-order viscerosensory neurons for cranial nerves 7, 9, and 10. The superior end of the solitary nucleus is going to receive mostly taste, while the inferior end is going to receive mostly GBA fibers. So we can go ahead and add those to our chart. Another thing that I should add is I said that the superior end of the solitary nucleus is mostly responsible for taste for 7, 9, and 10, and that superior end is called the gustatory nucleus. When you move up into the open medulla, you're still going to have the hypoglossal nuclei and the dorsal motor nucleus of the vagus. And they are separated from the lateral sensory regions by the sulcus limitans. A little bit more lateral, we are still going to have this solitary nucleus and tract. And then just lateral to that, we are going to have the vestibular area, which we know as what is in the lateral recesses of the fourth ventricle. However, these are special sensory nuclei in that they don't really fit into any of these other categories. You can still see our nucleus ambiguous in this branchiomotor region. We have our spino-trigeminal tract out here. Okay, so moving on up into the pons, where we have cranial nerves 5, 6, 7, and 8 associated with the pons. So in this general region, we have the basilar pons, where corticospinal fibers are traveling down to get to the medullary pyramids. Additionally, we have pontine nuclei that relay cortical information to the cerebellum. And then you'll be able to see some crossing fibers that are carrying information from the pontine nuclei to the contralateral side of the cerebellum. And they do that by traveling through the middle cerebellar peduncle located out here. There will be a cut of the cerebellum where you'll be able to see, of the pons, where you will be able to see the superior, the middle, and the inferior cerebellar peduncle. So on this cut, the superior cerebellar peduncle will be located medial to the inferior cerebellar peduncle. So at the level of the caudal pons, which is an inferior level of the pons, this is at the level of the facial colliculi. And you'll remember that underneath the facial colliculi is the abducens nucleus, which is a somatomotor nucleus that gives rise to the abducens nerve. Additionally, in the area where the branchiomotor nuclei tend to lie, we have the facial motor nucleus, which gives rise to branchiomotor fibers for the facial nerve. So we can go ahead and add those. So the facial motor nucleus is going to give rise to the facial nerve, which is going to innervate the facial muscles that allow you to have facial expression. Whereas the abducens nuclei are going to give rise to the abducens nerve that is going to innervate the lateral rectus of the eye, allowing the eye to look laterally. And located in the lateral recesses, we are still going to have the vestibular nuclei that are associated with cranial nerve 8. Okay, and then moving up into about the mid-pons level, we're still going to have the middle cerebellar peduncles that are bordering the pons, and there will still be some superior cerebellar peduncles. However, at this point, you can't really see the inferior cerebellar peduncle anymore. So at this point, you can typically see the trigeminal nerve coming in if you have a good cross section. And you can see the main nucleus of the trigeminal nerve. It's also known as the principal sensory nucleus of the trigeminal nerve, and it's going to receive discriminative touch and proprioception. It's kind of the equivalent to the gracile and the cuneate nuclei. So it would make sense that these GSA nuclei are located out very laterally. And in addition to that, the trigeminal nerve is going to have a branchiomotor nucleus located where the branchiomotor nuclei tend to be. So we can go ahead and add that into our chart. So you can see we're going to have GSA for the trigeminal. That is from the spinal trigeminal nucleus and the medulla, as well as the main nucleus of the trigeminal. And the main difference for these is that the spinal trigeminal is going to receive pain and temperature, whereas the main nucleus is going to receive discriminative touch and proprioception and vibration. Both of these components are GSA, and the motor branch is going to be SVE. And the motor function of the trigeminal nerve is to innervate the muscles of mastication for chewing and eating. Lastly, I'm going to add in one more nucleus for the trigeminal nerve, and that's going to be the mesencephalic nucleus. And this nucleus is going to hold GBA cell bodies that are going to carry afferent information for the jaw jerk reflex. So when your jaw is being stretched, it's going to carry afferent information to this mesencephalic nucleus, these GBA fibers, that are then going to activate this branchiomotor nucleus to allow for clenching your jaw. So both the mesencephalic nucleus and the main nucleus are sensory nuclei, which is why they're located out more laterally. So they would be lateral to the sulcus limitans right here. And it makes sense that the GSA would be the most lateral and the GBA would be a little bit more medial to it, keeping in line with our pattern. So I'm just going to add that in on our chart as a GBA nuclei for the trigeminal nucleus. That is the afferent for the jaw jerk reflex. Okay, so moving into the midbrain. So when we're looking at the cross sections of the midbrain, we usually look at them at two different levels. It's either the level of the superior colliculi or the inferior colliculi. And once you get up into the midbrain, that's when you have the cerebral aqueduct. So that's what we have shown here, rather than the lateral ventricle and the pons. So where around the pons we had the periventricular gray matter, now we have the periaqueductal gray matter located around the aqueduct. So we know that the two cranial nerves that are going to be associated with the midbrain are going to be cranial nerve 3 and 4. Cranial nerve 4 is going to be located in the midline, the very midline of the cross section. So you can guess that this is going to be made up of GSE nuclei, which means that the trochlear nuclei is going to be involved in innervating the superior oblique, which is a muscle of the eye. So on into the level of the superior colliculi, we have two more GSE motor nuclei that are the oculomotor nuclei. And they're actually located sort of in like a V-like region. So these are the oculomotor nuclei. So the oculomotor nuclei is going to provide innervation to most of the muscles of the eye except the lateral rectus and the superior oblique. The lateral rectus being innervated by the abducens nerve and the trochlear nuclei innervating the superior oblique. The last nuclei that we're going to talk about is the Edinger-Westphal nucleus, and this nucleus ruins our entire pattern because this nucleus is a GBE nucleus that's actually even more midline than the GSE. And this nucleus is going to contain the GVE component of the oculomotor nerve. Stimulation of this nuclei is going to allow for the eye to have pupillary constriction and contraction of the ciliary muscles, which will allow the eye to accommodate. So we can go ahead and add these in to our chart to complete it basically. And for now, don't worry too much about cranial nerves 1 and 2 because we are going to learn those in a different section. But now the table is almost complete. The only other things that I would add in for right now would be that the facial, the glossopharyngeal, and the vagus also have special sensations for taste. Additionally, the vagus nerve is going to receive some GSA fibers that carry pain and temperature sensations from around the external auditory canal. And these fibers will synapse at the spinal trigeminal nucleus. The vagus nerve is also going to carry some brachiomotor fibers from the nucleus ambiguus to innervate the larynx, pharynx, and soft palate. Additionally, the glossopharyngeal nerve will also carry some brachiomotor fibers that are from the nucleus ambiguus, and it only innervates one muscle from a pharyngeal arch, and that muscle is the stylopharyngeus, which is a muscle of the pharynx. The glossopharyngeal will also carry some GSA fibers that will synapse in the spinal trigeminal nucleus. Additionally, the glossopharyngeal nerve will carry some GVE fibers that are located in the inferior salivatory nucleus. The postganglionics for the inferior salivatory nucleus will innervate the parotid gland, which is what produces saliva in your mouth. And I should have drawn in earlier this superior salivatory nucleus that is located in the open medulla, just near the DMX. Additionally, the facial nerve will have some GSA fibers that go to the spinal trigeminal nucleus that are going to detect light touch in the external auditory canal. And lastly, for the facial nerve, there will be some GVE fibers that are located in the superior salivatory nucleus that will provide innervation to the submandibular gland, sublingual gland, and the lacrimal gland. The superior salivatory nucleus is also located in the medulla, but don't worry at this point about identifying that because we've never had to. So as you can see, 7, 9, and 10 are the big ones. Those are going to be the ones that are going to take a while to learn since they have all 5 modalities in their nerves. So there may be a few more details that are in the course pack that are not on this chart. I may have even missed a few of the modalities, but this can just be a way for you to organize it. Another image/way to diagram this out is by using this diagram. You can work up, it's on Dr. Smith's PowerPoint, but from this you can work up from what are the GSE fibers. So that would be the hypoglossal, the abducens, the trochlear, and then the ocular motor. And then you can work up for what are the brachiomotor fibers, which they're not necessarily lateral to it, but they are more anterior in the spinal cord. So that would have the accessory nerve, the vagus, the glossopharyngeal, the facial, and then the trigeminal. Then you can move out to the GVE fibers, which would have the vagus, the glossopharyngeal, and the facial, and you can just kind of work your way up. I think that's a really good way to study as well.